Hi guys, it's Dr. Chinhara again in another segment of Truth Be Told. So brace yourself. Today's topic is actually quite basic. I want to talk about brushing. As simple as it sounds, in my years of practice, I've seen all kinds in people's mouths. So brushing really is not just a morning routine. You get up in the morning and you feel a bad taste in your mouth and you brush and you're done with it for the day. I just want to mention that actually the reason we brush, and it should really be several times through the day, is to maintain an environment that is not posing danger to our teeth and to the supporting structures for those teeth. So there are two diseases that we are battling with all the time. The one is tooth decay. So, our mouth has bacteria, normal bacteria that's there in the mouth. But if the population of this bacteria is not controlled through good brushing and oral hygiene on a daily basis, then this bacteria will tenaciously sit on the teeth and it breaks down the sugar that is found in our diets, produces some acid, and that acid will then leach away at the mineral structure of the tooth, and that's what we call tooth decay. And once the tooth is badly damaged, you can't save it, you end up having to remove the tooth. So it is important for regular visits with the dentist to pick these things before they get out of hand, so that we can control any problems with the mineral structure. Then the other one has to do with the gums and the bone and the supporting structures that hold our teeth together. When we live long enough, we eventually lose our teeth. The gums recede, the teeth are no longer anchored well, and eventually we lose them. I mentioned this too because those are the two that are within the control of the patient. You must have a real routine, a deliberate routine to control this in your home care and the visits that you make to the dentist. But particularly for us in orthodontics, we are really quite relentless about that. So when we're working with young children, we take this opportunity because we have a relationship for about 2 years when someone is wearing braces. And I want to take this opportunity to develop in the young kids a good oral hygiene habit so that they can keep their mouth healthy in the long term. So oral hygiene routine, a good oral hygiene routine is very important. And oral hygiene consists of brushing, flossing, and also just a proper diet that does not expose the oral environment to these diseases. I'm going to let Angela explain to you how to be an effective brusher.
There are different ways to brush. The one we're going to start with is brushing without braces. Using a soft bristle toothbrush, you start from the back molars, taking a toothbrush all the way into your gum margins and making sure all the food that's trapped underneath is taken out. You also brush the inside of your teeth, as being shown on the video. It's very important to take out any stuff that's stuck there. The back molars, you brush on top of the chewing surfaces because most of our chewing is done at the back of the teeth on the molars. It's also important to brush your tongue to reduce bad breath as well. Brushing with braces is almost identical to brushing without braces. As mentioned earlier, you start from your back molars, making sure you're brushing along your gum margins to take out all the food and debris that's stuck in there. Underneath the wire, over the wire, and in between the braces is very important because when you have braces, food normally gets stuck in those areas. So make sure you do it diligently, underneath, on top, and in between. Just like before, also the chewing surfaces, the back molars are very important because that's where most of the chewing is done. Once that is done, make sure the gum margins on the inside are also brushed to make sure the teeth are nice and clean from the inside. The tongue is also very important because we also want to eliminate bad breath, especially when you have braces and the food is getting constantly stuck in between your braces. Upon getting your braces, the orthodontist provides you with what we call an interdental brush, or otherwise known as a proxy brush to many. This little brush helps you get in between your braces and all the hard to reach areas where food might have gone through. Sometimes the toothbrush may miss these areas and this little brush helps us to go in between. The the braces to take that food out. This is very important because we don't want any food getting stuck in between the braces. Please note, this is not a substitute for your regular toothbrush. Flossing is very important. It can be done with or without braces, but with braces it's a little more involving. You can get floss with a threading point or you can buy them separately. All you need to do when you have braces is to make sure your floss goes underneath the wire all the way to the gum, out through the other end, and do scooping motions to take out the food particles in your gum margins. Make sure to do this in between every tooth and at least 3 times a week.
Thanks, Angela. Guys, that's all for today. Please remember, brushing is important. See you again on the next segment of Truth Be Told. Bye.